Hello and welcome to my drug info channel. My name is Sean Navin and today I'm going to be talking about Trulicity. So Trulicity is an injectable medication for people who have type 2 diabetes. So if you were just prescribed Trulicity, you may be wondering, how do I inject this thing? Maybe they didn't have time at the pharmacy to show you or your doctor's office to show you. So it can definitely be confusing to know where to start with this. So today I'm going to walk you through how to inject this medication. Before we jump into how to inject it, I want to just give you a little bit of info about Trulicity. So Trulicity is part of the class of medications called glucagon-like peptide 1 agonists. And so they mimic a naturally occurring hormone in your body, and they help with your diabetes a couple ways. So they help you release your own insulin naturally, which is good. Insulin is going to help lower your blood sugar. And then some of the better benefits, I think, is that it slows down digestion. So this is really going to help you feel fuller longer. You're not going to eat as much, and this is all going to help lower the blood sugar levels in your body. So you're going to eat less, so that means you're probably going to lose weight. A lot of people do lose weight. Some people's blood pressure improves with this medication. So I actually think the GLP-1 agonists, that's how we refer to them shorthand, I think they're a really good class of medications for type 2 diabetes. And I know they're super expensive and they're the newest, fanciest drug, but I think actually the mechanism of action gets to the root of type 2 diabetes. And really, the root of type 2 diabetes is an excessive amount of fat builds up inside of your pancreas, and then your pancreas can't secrete its own insulin. So these drugs help to address that issue, and I think that's why they're so effective. So one common misunderstanding with these medications, just so you know, is that this is not insulin. Insulin is a different hormone, it's a different drug. So Trulicity and other drugs in the same class work differently, and even though it's an injectable and it is a hormone, these are not insulin, so that is good to know. Okay, so let's dive in and let's walk through how to inject these. Okay, so here's the injectable Trulicity. So I want to walk through just a couple of key features of the pen itself. So when you take it out of the box, you'll notice that it looks very similar to this. It's going to have a cap, which is where the needle comes out of, and then you'll notice a button. This is the button that you're going to push. That's going to administer the injection. And then another key feature that you're going to want to notice is this symbol here that shows you whether it's locked, which is the red part, or the green part you can turn it to, and that would unlock the device. So those are kind of the key features of the pen initially, and we'll walk through each part so that you'll know how to use each one. So step number one to inject the Trulicity, you're going to take off the gray cap of the pen. So you pull it off like that, and this is where the needle is going to come out of, right through this hole. Right now it's safe, it's not going to inject at all because it's still locked here. So now that we pulled off the cap, the next step is to choose where you want to inject the pen. So there are 3 places that are commonly used to inject. You can actually use the back of the arm. So some people will reach back and use the back of the arm. Some people have a hard time doing that. So you might have, a family member or caregiver help there, but you don't have to use the arm. The most common place, honestly, is going to be the abdominal region. So anywhere around the belly button is going to be an okay place to inject. So anywhere in this area. Another place that you can inject are the thighs, here and here. But again, the most common is the abdomen, so that's what we're going to do today. Okay, so now that we've chosen the abdominal region to do the injection, what you're going to want to do is, now that you've taken the cap off, you can just lift up a small part of your shirt, and you just want to place it, again, here's my belly button. You're going to place it just next to it in this region. And the next part of this step is that you're going to now that you have it pushed against your skin, you can now push the green button, which is going to inject the needle. So it's kind of nice. You can kind of put your shirt down. You don't even have to look. The prick is very minimal. You probably won't even notice it, honestly. And so When you're ready, before you actually hit the green button, if I push it right now, it's not going anywhere. That's because it's still locked. Remember, I mentioned it, one of the features is that there's a lock feature. So it's still locked. You want to make sure, in order to push this button right now, I can't. You want to click it over to unlock it. So it's now unlocked there. I also want to let you know that when you're looking at this part, the medication should be clear. It shouldn't be cloudy or turbulent. So you always want to be checking there. And this is there shouldn't be any objects there. Once we inject the medication, a gray part will come here. So I'll show you that once we inject it. So just remember to check that. Again, I just turned it to unlock. So it's ready. If I push this now, the injection will go. So to now get the injection, again, I'm going next to my belly button. Again, anywhere in this region is fine. You could do the other side too. I'm gonna go right here. I'm gonna go down. And then now that I'm ready, it's unlocked. I'm gonna go ahead and push the button. And when I push the button, I'm holding the pen against my skin. Don't pull away yet. So I'm gonna push it. So you hear the click, and I'm holding for 5 to 10 seconds until I hear another sound. So there's that second sound. Once you hear that second sound, again, it varies on the time, but it's usually 5 to 10 seconds. Then you can remove the pen and you are good to go. So that's pretty much it. Notice now this gray part, kind of hard to see with the light there. The gray part has come in, so that's when you know it worked. I'm now going to lock the device. The button pops back out, and I'm gonna put the cap back on here. You want to discard these in a sharps container. You don't have to put the cap back on, you just discard this in a sharps container, but I like to put the sharps back on just to kind of cover up that and make sure that the needle doesn't get exposed to anything. So that's pretty much it. It's pretty easy. The injection doesn't hurt. There's 3 main steps. Again, you're gonna remove the cap. You're going to choose where you're gonna inject the needle. Again, the abdominal region is the most common. You're gonna put it against your abdomen. You're gonna make sure you're gonna unlock it, and then you push the button for 5 to 10 seconds until you hear that second click, and then you can remove the device. So pretty easy. Trulicity is used once a week, so it's super convenient. You don't have to do it every day like some other pens, so just once a week. The doses come in 1.5 milligrams, 3 milligrams, and 4.5 milligrams. Usually we're gonna start at a low dose to get your body used to the medication and get used to the side effects, because like I said before, the medication does slow down gastric emptying, or it slows down digestion, and you can't eat as much, so you get a lot of feeling of fullness and nausea. So the first couple weeks we usually start at a low dose to kind of get you used to the medication. So best of luck. I hope this video helps you understand better how to use the injection, and we'll see you next time.